Hi, Dr. Riaz Agha here, Harley Clinic Group on Harley Street. I wanted to ask and really put out the question, what makes a great tummy tuck? I've been doing tummy tucks for many years now. Many patients come through to me seeking to have excess skin and fat removed from the tummy. I've been really privileged to have a great set of patients who've been really happy with their results. But we need to sort of ask the question, what really makes it great? What leads to that happiness, so we can continually think about how we can do better? I think a great tummy tuck really starts with getting the patient's goals and requirements correct, really listening to what they want and understanding it, and then coming up with a bespoke solution for them. So my tummy tucks typically are combined with liposuction, and I typically would do a drainless tummy tuck. I think this leads to the best overall outcome for the patient in terms of removing excess fat that will be either in the central or the lateral columns of the abdomen, and also removing excess skin, and also then leading to a quick recovery, which is less painful, and earlier mobilization with a drainless approach. The best tummy tucks that I've done have a low scar, which is relatively flat. We do not want a scar that comes right up and can be visible above underwear or the jeans or any sort of low-cut trousers that people may want to wear. We want the scar to be nice and low, to be fine line and flat. We want a tummy tuck which also helps to sculpt the body and really helps to give that washboard appearance and really sculpts the tummy to give it that flatness and help somebody get that look that looks firm and tight, where the muscles are coming through and you can see that definition in the abs coming through ultimately with time. And also you've got a nice waist, and this is where the liposuction comes in. Having a nice waist is really important. Most ladies will say to me, I want to have a nice tight waist, and some will use the word snatched. They want to have a snatched waist. They want to have nice tight waist. So utilizing liposuction with a tummy tuck is really important. Giving them a waist, giving them a contour in 3 dimensions. So that's really important. Getting the size right, getting the symmetry correct, getting the shape correct, getting the contour correct, getting the scarring correct. It's really, really important. The other thing that's really important is a really good belly button. If you have a look at before and afters of different people who do this kind of procedure, have a look at how pouchy the belly button is. Is there a lot of excess fat that's been left around the belly button? Are there stitch marks from the way they sutured it showing through? How neat is the scar around the belly button? Is it really tight? Has the shape of the belly button been made really poorly, or is it a nice round shape with a decent size? So have a think about belly button shape and size and symmetry and scarring. It is a really important aspect of tummy tucks. It is a long operation. It's about 2.5 to 3 hours or so, and it is one where the results are going to be looked at for many, many, many years. Women will always remember who did their tummy tuck and how it's gone, and if it isn't 100% perfect, be something that they will come back to you on. So it's important to take the time and get it absolutely perfect, and that's what I try and do each and every time I'm asked to do a tummy tuck. I try and get it absolutely perfect for that patient. One of the things that's really important as part of a tummy tuck is to do a really good repair of the rectus abdominis, or the six-pack muscle. When a lady has been pregnant, the muscles can often part, so the six-pack muscles can often come apart like this. They don't always go back together once the baby has been delivered. That gap can often be about 3, 4, even 5 centimeters when you actually go and do a tummy tuck. It's really important that that is closed and that the muscles have come back together and been sutured in the midline like this, what we call a rectus plication. Now I do that in 2 layers, above and below the belly button. It's really important to have a robust repair process with a good strong suture that helps to keep that repair for the long term. One of the things that we've come to know about in recent times is why it's important to reduce that gap. And there was recently an Australian study which found of 3,000 women, which found that over 90% of women who had a tummy tuck with the repair of these muscles, six-pack muscles, actually benefited in terms of their lower back pain, their urinary incontinence, as well as core strength. So it's really important to actually do a muscle repair as part of a tummy tuck. So always when you're going and asking surgeons about tummy tucks, always ask them about the muscle repair, confirm that they will do it and how they'll do it, and get all the details that you need to make sure that it's going to be done to the highest possible standard.